organizations that insisted that we use the vendor they had decided on for the fields, who did not have any options they were willing to offer other than the Kern River underlayment. I did bring that up. I had the staff study what it would have to be the cork, or I think there's something that's a coconut mat, that are less toxic to put under those fields. The cost was prohibitive, and again, like I said, in some of them, the matching grant did not allow for us to use them. But as you will notice, most of those fields are in the near south side or the north side. Again, it's one of those things where I feel here we are giving what is supposedly an excellent field type for these folks to use, but then we're putting poison underneath it. And so as the minority vote, I have been against these. But again, what folks need to know is there is density in Minneapolis on purpose, but we don't have extra land we can designate to park space. Why we have put in artificial turf fields is because they can stand much more use, particularly places like the field at Curry or the field at East Phillips, where we have tons and tons of use and in a small area with lots and lots of people. I would prefer that in the long run we be requested and asked to use other underlayments, but again, I am the minority vote on the park board. But I just wanted you to have the accurate information on where we have these fields and what types they are. Thank you.
Appreciate you coming in and lobbying us on your minority position. I do. I know that some of those fields use the running shoes or the athletic shoes ground up too. Appreciate that. I don't see anybody else coming forward to speak, so I think we'll end the comment section here. As you can see on the agenda, what I was proposing that we do with this is direct our advisory groups to look at this again, the same groups that did last time. Our commission, I think it had a different name back then, but CEAC, our Commission on Environmental Advisory Committee, or Community Environmental Advisory Commission is its formal name, and also our Public Health Advisory Committee. So I would like to move that we receive and file this report. And as soon as I find the exact staff direction, I can read it out loud. And that we also request that the Public Health Advisory Committee and the Community Environmental Advisory Commission study and make recommendations regarding the use of waste tires as ground cover in Minneapolis, and report back to our committee in February of 2017, and also direct staff from the Health Department and the City Coordinator's Office of Sustainability to work with the two advisory groups to support their efforts to study and make recommendations regarding the use of waste tires as ground cover in Minneapolis. I think we're a ways off from doing anything. I think we had some interesting discussion here. What legal authority do we have in this? Also, there's work going on at the state. Obviously, there's new information that we have since 2008 and even new things that other cities have done. And I'm hopeful that the groups might look at best practices in other cities and what we can do. I really appreciate concerns that were raised about the safety of the fields but more so of the playgrounds. I do know that the park board, my understanding from them is they don't use the tire mulch on any of their playgrounds, so they've either decided to go with the rubber pads or I think most of it is wood fiber, but it's interesting decisions that people have to weigh those. Also, the issue of how do we replace these fields that did get put in with the tire crumb in an equitable way, that's something we'll have to look at too. Is there any other questions or other comments on it? I suspect lots of my committee members want just to go right ahead to the ban, but I think we're going to just refer it to our committee so we can move forward thoughtfully and carefully. Okay. All those in favor say aye. Aye. Any opposed? Okay, that motion carries then. And now we're ready to move on to our next item. And I'll note that the PowerPoint presentation will be posted, hopefully, on the website now that it's been done. Okay, thank you very much. So now we're ready to move on to item number 10. And this is our annual report on emergency preparedness from the Public Health Department. Welcome. Take a minute to get ready.
I guess so.
And we're ready for you. Hi. Thanks for being here.
Mr. Chairman, members of the committee. My name is Pamela Blix. I'm the Preparedness Manager for the City of Minneapolis in Health. And this is an annual presentation to you that is required as a part of our federally funded grant. And today we're going to provide some background about public health preparedness in the city, highlight some of the key accomplishments for this year, and present some of the challenges that we face going forward. The folks in our health department, our staff, are all federally mandated as responders for any sort of emergency and on a 24/7 basis. And one of the things that we do in particular in our department is to focus on at-risk populations. One of the things that department staff face as a key challenge is that, unlike fire and police or public works, it's not something that we do on a daily basis. Our staff don't train daily or respond daily. So when we're called upon to respond, it's something usually new and different from our regular job duties. One of the things, though, that we do know about health emergencies is that typically they don't have boundaries. We cross geographical boundaries from one side of the river to the another pretty easily because of disease. It just kind of spreads that way. And it goes on a long-term basis. Unlike fires, which generally get put out on fairly quickly, disease events tend to go on for some time. We also are required to coordinate with all levels of government, federal, state, and regional agencies, and utilize them as our partners and our resources. And yet our funding continues to dwindle. We have a small team in our department, and I was going to introduce them today. We have 2 full-time people. We'll both be speaking today, myself and Tony Hauser, who's our preparedness specialist. And then the other folks are just kind of part-time or volunteers. Lane Brown, wave your hand. She's our support staff. Jenny Lansing, who works primarily in environmental health. She's helping us with a climate grant. And then Zhao Wang is our intern for the summer. And then you probably all know Becky McIntosh, who is our fearless leader. I've served in this role since 2002, and Tony has served in her role since 2009. So we have a breadth of experience at our disposal, but again, we are the only 2 full-time folks. The federal funding for preparedness started in 1999, but over the course of time, the funding has, I will just say, I'm using a 10-year time period because it was convenient, but it's been reduced by 92% in the last 10 years. So we are on a diminishing tract of federal funding support, and that is the only funding that really supports preparedness at our level. Today we're going to talk about some of the key areas that we've worked on this past year. We have 15 areas of responsibility that the CDC has identified for us. And some of the 3 key areas that we've worked on projects in the last year, this past year, are in community preparedness, volunteer management, and emergency operations coordination. One of the things that this mandate is doing at the federal level is trying to align with emergency management, which in the city of Minneapolis is the overall coordinating department for emergency preparedness within the city. So they have their own set of requirements, much like these. And then the hospital medical system, which also has a very similar set of requirements. And so the feds are trying to get us all coordinated so that we're all kind of doing the same to-do list together. So there's a whole big effort at going forward to try and coordinate the groups. So that's the area that we are working at on a regional and state level is this coordinated effort with our partners in the hospital system and with emergency management. And with that, I'm going to turn it over to Tony to talk about the areas that we worked on this past year.
Thank you, Mr. Chair
Welcome.
and committee. My name is Tony Hauser, and I work as an emergency preparedness specialist in the health department. We're going to focus on the three areas that Pam mentioned. The first one is community preparedness. So we really tried to focus some of our work during the last year on community preparedness, even though it's something that we haven't really been able to emphasize lately due to budget cuts. So we worked and supported the Office of Emergency Management in holding 3 Ready Camp sessions where community members were brought in and learned about personal preparedness topics. We also, again, participated in the Downtown Improvement District's annual Prepare Fair held every year in the IDS Crystal Court. With the expert help of Lane Brown, our program aide, we are now able to quickly and efficiently reach broader audience through social media. An example of one of the graphics that Lane developed is on that slide about, are you paying attention to weather changes? We have also updated our memorandums of understanding with the 10 community organizations that we have working relationships with. And then those organizations, along with a number of other community organizations, attended our annual meeting on March 1st. There were over 50 representatives from across community agencies. Our featured speaker was Ty Mendenhall. He's an associate professor at the University of Minnesota, and he shared tips about how organizations and people who work at the community level can help the community, their staff in the organizations, and others affected with grief and hurt after a tragedy or disaster. With volunteer management, this was an area that was identified, especially after the 2011 Northside tornado. It's a really complicated subject because people always want to help, but you want to make sure that you're getting the right people. And we've done some work with this during previous years, but this year we really made some accomplishments. We worked with risk management, the city attorney, and our partners in the Office of Emergency Management, and to identify pools of volunteers. We created a liability form, developed some policies and procedures for calling up volunteers, when they should be called up, and who we can reach out to, different volunteer groups. Emergency operations coordination is the third capability that I'm going to talk about, and it's kind of a little bit vague, but it has to do with how we get our act together in order to respond. So at the request of Commissioner Musicant, our team was tasked with providing our health department's incident management team opportunities to learn, practice, and simulate the initial setup phase of likely responses that we would be involved in. The 3 that we did were medication dispensing, assistance and reunification center, and a mass shelter. Interestingly, those are all ones that we've participated in the past. So we had some experience, even if we didn't have plans back then. So the name of the group of exercises that we did was Operation Developing Habits. And it was a series of 9 functional exercises that were held between March 2015 and March 2016. And it involved our incident management team setting up the areas at a response site. We simulated, and we were in the public service center in the basement. But they set up the initial areas that we would need in order to respond to an emergency. And there were 57 health department staff who participated. They spent about 768 hours participating in the exercises. That doesn't include all the time put into planning. And those 57 staff also spent an additional 87 hours in doing preparatory training for those exercises. We have a lot of areas of improvement identified from these exercises, including providing additional training for our workforce and supply units, developing an annual training for 800 megahertz radio use, creating a reunification unit that can be activated immediately before the rest of our operations are set up, and identifying opportunities for us to practice efficient decision-making and gain confidence in our response roles. I would just like to point out that during calendar year 2015, our department staff put in 2,302 hours of additional time to emergency preparedness, orientation, training, and exercises. And none of this comes out of our federal fund. It's all whatever grant they're using to pay their salaries went to support this work. In addition to our department, we also work with partners across the region and the state. The city's Readiness Initiative region is made up of 18 counties and 4 cities, and 2 of the counties are in Wisconsin. This is the graph on the top left. And we do primarily a great deal of planning for medication dispensing with these partners. But we also have the Metro Public Health Emergency Coordinators Group, otherwise known as FEC, and that's made up of 9 community health boards in the Metro. And this group is responsible for developing work plans and activities that are to be done regionally, that are best done regionally, and that our region can gain more from than if we did them all independently. And the 2015 annual report, of which I have a few copies available, was attached to the RCA for you. So our work is completely funded by the federal government, and I know Pam touched on this earlier. This is a graph of funding for the city of Minneapolis from our 2 main pots of money, the city's Readiness Initiative and the Public Health Emergency Preparedness Grant. And you can see it's slowly gone down. I did a little math today, and it came out that we've, since 2008, we've taken about a 33% cut cumulative from both of those grants. This has been especially challenging because as the money keeps getting cut, we keep becoming responsible for more work. There's more guidance coming down from the CDC about what public health is responsible for. We continue identifying different areas in the city here about how public health can further respond during emergencies. So we've worked really hard to build and sustain this all hazards preparedness infrastructure. But large-scale emergencies like the 2009 H1N1 pandemic, Ebola, and currently Zika require sufficient and reliable core funding to maintain a solid and ready public health infrastructure, and additional funds to build community resiliency in order to really provide the protections and services that people living in Minneapolis deserve. So that concludes our presentation, and we were happy to stand for any questions.
Thank you very much. I appreciate the presentation. I just had one quick question. When you showed the slide about emergency operations coordination, you did 9 exercises with 57 staff, and is that all health department staff? And
that is all health department staff. There were additional staff from Hennepin County Human Services, Hennepin County Public Health, and the American Red Cross that also participated, but they're not included in those numbers.
And is that because there's 57 health department staff who are designated to be first responders for a public health emergency?
Currently, on our incident management team, there are 51 people identified. So the extra 6 include other people in the department who are interested in just observing the exercise. We had a couple of our CDC associates who wanted to participate to get some experience. So we kind of open it up for other people.
Well, interesting. So a lot of those people actually normally would do other jobs, but they put those on hold. That's about half the department too, isn't it?
Yep.
Okay. I don't see any other questions. Then I think we can just move to receive and file the annual report. And thank you very much for the presentation and
Thank
the
you, Mr.
report.
Chair.
All right. Any questions on the motion? All those in favor, please say aye.
Aye.
Any opposed? That motion carries. Then we have 2 items left. The next one's the 11th one on the agenda, and it's our neighborhood programming and support audit report. So we did an evaluation, and there's in addition to receiving the report, there's 2 staff directions that committee members might want to notice as we listen to the presentation. And let Mr. Rubidor start us off. Welcome.
Chair Gordon, committee members, good afternoon. I am David Rubidor, Director of the Neighborhood and Community Relations Department. And I am going to be presenting the the evaluation of our neighborhood programming and support with Bill Smith, who is with Vico and Associates. And so we'll be co-presenting the results of that evaluation today. Basically, just a couple of quick opening comments on this. I would say that this process has been very helpful for us. It's given us some really good feedback from the neighborhood organizations that we work with directly, as well as the NCEC commission members, to give us some good insight as to the work that we're doing. And in today's presentation, we're really going to focus in on just some of the highlights that came from the evaluation and some of the operational changes that are actually already underway and some of the ones that we're actually proposing as we move forward. Specifically before the committee today are the 3 requested actions, which are on the PowerPoint here. I won't go through them in detail because they're a little bit lengthy, but basically receive and file. The second thing is looking at options for combining the Neighborhood Community Engagement Commission and the NRP Policy Board together, and I'll talk about that a little bit later as we move forward. And then also the third one is looking at funding options for ongoing funding for neighborhood organizations post the termination of the consolidated TIF, which is scheduled to end in 2020, which has been the primary funding source for neighborhood groups for the last approximately 7 years. So the purpose and scope of the evaluation, just to start off, the NCR department actually requested this in our budget request way back in 2014 for a 2015 budget allocation. Our purpose of requesting this was really, we had been up and running for 3 years, running the 2 neighborhood programs, the neighborhood revitalization program, as well as the community participation program. And we really wanted to get a good indication about how that was working and what our service was for neighborhood organizations. The council fortunately funded it, our request, and we spent the last year working with Vico and Associates with doing the evaluation. I will say that the scope of this evaluation is limited to just the neighborhood programs of NRP and the community participation program, and our neighborhood and the support that the department provides for neighborhood organizations. It does not include the other aspects of the NCR work, which includes Americans with Disabilities Act, cultural outreach work, language access work, and so on. So I just wanted to be clear about that. The evaluation actually started, the field work started, I believe, in June of 2015 and concluded in February of 2016 of this year. The work was also led by specifically the Internal Auditor's Office, Will Tetzel, and a big thank you to Will and his office for supporting this. I think their contribution and oversight of this really led to a very valuable report, and also provided that third-party kind of independent review that we were looking at that was not led by the department. I also want to thank Councilmember Palmisano specifically with her leadership, both with the internal auditor's work, but also with the audit committee, which has reviewed the report and has forwarded it on to the HEC committee. In addition to that, we had a steering committee set up that oversaw the evaluation work as it was being done. led by Councilmember Gordon, as well as Councilmember Palmisano, included the city coordinator, Spencer Cronk, myself, and then Howard Blinn within our office to coordinate the internal work within the department. So with that, if I may, hand it over to Mr. Smith to go over the details of the evaluation process and the evaluation team.
Thank you very much.
Welcome.
William Smith with Beco Associates. The evaluation team was led by me. I'm with Beco Associates, as I said. Assisting was Nora Hall with Gray Hall, Karen Gray with Gray Hall, and also Paula Pintel, who is currently coordinating the Urban Studies program at the University of Minnesota. The methodology was an iterative methodology, meaning that we would develop assumptions, come back and check. We had a process for correcting misconceived assumptions along the way and being able to respond to new situations as they arose. We gathered input from a host of people, City Council, also from the NCR Department of Management, NCR staff, the NCEC commissioners, staffs, boards, and members of the neighborhoods organizations. And there was also an extensive review of the reports that are submitted by neighborhood organizations for the periods of 2011, 2012, 13, and 14. And our key findings, there were 5 key findings, and the first of those was that we found that the department is meeting its overall expectations as outlined in the framework for the future. And just briefly, those expectations fell into 5 categories. The department was to develop and administer a new department, to administer grant funds, advise the mayor and city council, and also work with city departments on community engagement, to administer the 2009, post-2009 NRP, and that's including phase 1, phase 2, and then to administer the CPP program. We did find that while all those things had been done, the neighborhood organizations were clamoring for something else in addition to that, and that was sort of an advocate or a champion within government, within city government. You want to respond to that?
Chair Gordon and committee members, what we thought for format today is that Mr. Smith would go over each finding, and then we would talk about the NCR response, and then we could move on to the next one, so we just do both at the same time. So if it's okay with the chair, we'll tag team here a little bit. So regarding the findings, number 1, about meeting overall expectations, the department agrees with the conclusion of the evaluators. We also recognize that the framework for the future is a dated document. It was developed, I think it was actually finalized around 2007. It did really serve as the framework for the establishment of the department and the work that was intended behind it. But we also recognize now we're evolving into the next kind of phase or iteration of neighborhood work moving into the future. And so we recognize it's time to have the discussion about what happens in the next decade and what the next decade of neighborhood organizations looks like. So we've commenced those conversations. We're starting conversations with neighborhood organizations themselves, engaging the stakeholders around that. We are also, the discussions have started to occur with the NCEC, the Neighborhood Community Engagement Commission. We do have a new version of the community participation guidelines, which will be coming to this committee on the next cycle, which will have a number of changes also that are coming into it. And then also, I believe the staff directive that is being proposed today will continue to further those conversations. We're about 3 years before the funding cycle ends and the next generation, before we go into the next decade of neighborhood organizations. And so we believe it's time to really take these discussions in earnest and move them forward.
Our second finding was that the department had been very successful at providing assistance to neighborhood groups in some key areas. The focus of that assistance had been helping neighborhood organizations operate efficiently and with transparency and meeting legal requirements. But again, neighborhoods are asking for assistance that goes beyond that, beyond the financial support and governance kinds of support. And I'll talk more about that, but what neighborhood organizations seem to be asking for is an advocate or a champion within city government, someone to help them do sort of strategic planning and figure out how to advance their issues and to win on the issues to get what they're looking for. And that goes beyond the that sort of limited scope, important but limited scope that NCR staff was providing.
Chair Gordon and committee members, to continue on. So we agree with the findings of the evaluators. In fact, we'll just say blanketly, we agree with the findings all the way through the evaluation. One of the things that we do as a matter of practice as we go through the annual reports that neighborhood organizations to submit in order to be able to look at ways that we can improve our effectiveness and our work with the organizations. One of the things I think that the evaluation highlights is that the capacity that we have in order to support neighborhood organizations is also limited, as resources are limited. And as such, to provide additional services above and beyond what we're currently providing, I believe the report goes so far as to recommending that we double our staff. What we did instead is we took this information as well as some other feedback that we were getting from within the departments within the city. And we're in the process right now of reorganizing our management structure. In fact, we've actually finished reorganizing our management structure. But we're basically taking our access and outreach team and our neighborhood teams and bringing them into one team to really provide a broader, better connected level of support, both for the enterprise as well as for neighborhood organizations. And specifically in that, my goal here is by bringing those two teams together, which have in the past worked more discreetly, to be able to provide more support to neighborhood groups with cultural outreach and inclusion, which is one of our goals with the CP Community Participation Program, as well as to be able to better provide those connections within the city. So we're trying to maximize the capacity with what we already have. And the second thing is in our budget request this year, we are going to be asking for an additional FTE to be able to increase our capacity to go into the areas that were outlined in the evaluation and to expand our support to neighborhood organizations to be more around strategic planning and other levels of support. One other thing I do want to mention that was included in the report that Mr. Smith didn't mention, but one thing that we're very cognizant of, and it is a big concern with neighborhood groups, is the actual processing of payments for paying on invoices when they come in. We put a very high, and the report I think does a very good job about highlighting what the neighborhood's concerns are around that. We put a very high priority on processing payments. We know we're dealing with 70 independent nonprofit organizations that cash flow is paramount in their ability to function. So we place a high priority on that. I will say that the finance department actually tracks payment processing time for each of the departments, and that NCR is well below the city average and actually below the city goal of processing payments within 30 days. So we know we need to probably communicate that better to neighborhoods about the amount of time that it takes, but we also are processing the actual metrics behind that are showing that we're processing payments typically about 7 days faster than the city average.
The third finding from the evaluation was facilitating the Community Engagement Commission. We generally found that the commission is not functioning as effectively as it should. Part of our input in this evaluation.
It is still on finding 2, just on the overhead.
Sorry.
Thank you.
Thank you very much. We found that council members, we interviewed each council member, and we found that many of them were confused or unaware of the role that the commission played. In the input that we received from the neighborhood organizations, we found the same thing, that neighborhood organizations were not clear about, many of them, some were, but many were not clear about the role that the commissioners played. And then when we held focus group meetings with the commissioners themselves, we found that they were not clear about what their role was. What we found, though, is that there is interest in seeing the commission do more. There, as you know, that several of the commissioners are directly elected or selected from the neighborhood organizations. At the same time, the commissioners many of them were not, some were, but many were not going back and talking to the neighborhood organizations. And so there is an opportunity to improve that. Additionally, as David mentioned just a few moments ago, the initial framework for the future did outline a role for the commissioners, but that has changed. I think they fulfilled that earlier process, and now it's really time to look at something new. So we have some recommendations for strengthening, generally to strengthen the relationship between the commissioners and the neighborhoods, to redefine their mission and purpose. And then with this issue coming up of funding in the next 3 years, to really engage the neighborhood organizations so that community members have an opportunity to participate in that decision making.
Chair Gordon and committee members, again, we agree with the findings of the evaluators. We put into place recently some additional support for the NCEC, which includes orientation for the new members. In fact, we've had orientation before, but we've enhanced that more. Last year, they spent a good deal of time putting together a strategic plan to really help focus their work so they understand their roles better. And then also, they've been starting to hold community forums around the city around various topics as a way also to focus their work both within the community and within themselves. I will say, in addition to that, we've been putting more of an emphasis of the expectation is to make sure that you're connecting with both community organizations as well as neighborhood groups in the work that you do. We do recognize that all of the members are volunteers and that this is some work that additional work that they're due. I will say one thing with the NCEC is over time, the NCEC has evolved quite a bit. The early days were very chaotic and sometimes conflicted, but it has evolved into a much more functional group. They've adopted additional operating policies and procedures that have helped considerably, and it's a very committed group. And one thing I do not want to anybody to walk away from this meeting today with the understanding that NCEC members commit a tremendous amount of time to their efforts with the city, that most of the commissioners go to multiple meetings a month and spend a great deal of time. So part of this is balancing the time commitment that they're already putting in with an expectation that they continue to support with their community. Having said all that, we also know that in this process, and also one of the staff directives before you today, is that there is confusion about what the NCEC should be working on. This program, the neighborhood programs, actually have two different boards that oversee the work. One is the Neighborhood Revitalization Policy Board, which oversees phase 1 and phase 2 of the neighborhood programs and of NRP programs. And then we have the NCEC, the Neighborhood Community Engagement Commission, which oversees the community participation program. It is frequently confusing to commissioner members as well as policy board members and sometimes staff about who should be doing what, when, and who needs to approve what and when. And a lot of times we end up kind of dual tracking initiatives through the process. An example would be the upcoming changes to the CPP guidelines have gone through both of those boards and commissions, with those recommendations being incorporated in what will be brought forward. Having said that, however, I think there's an opportune time here to really look at combining these two functions into one. I think it's confusing to neighborhood organizations about which ones they need to go to, which ones they should be connecting with, and that by combining and looking at options anyway of combining the two boards into one, that will make it a lot clearer for both the commission members and their experience there, as well as neighborhood organizations as to which groups they should be working with.
Communicating better with the city council was an evaluation finding. And again, through the interviews that we conducted with council members, we learned that many council members felt that they were left in the dark, that they weren't kept abreast appropriately, adequately. And so there was just a recommendation that there really needs to be an improvement in communication. And that we did suggest as well that to the extent possible, the department should work with people in neighborhood organizations and with NCEC, so they're involved in the communications with council, and it's just not coming from the department staff.
Chair Gordon, committee members, and again, we agree with this finding that we can increase our communications with the council. I do believe that as a matter of practice, we try to bring NCEC members forward when we're presenting items